So here's a picture of shingles. So again, it's acute infection of the peripheral nerves, and it tends to run in that dermatome pattern. Most of the people who I have seen who've had it, it comes around like the trunk and the back. It's very painful, but I did know a gentleman who had it in his eye, which was crazy. He actually lost some vision. But, they are very, it's particularly with the older folks, with senior citizens and people who are immunocompromised. They pay close attention to shingles, and they even do some vaccines now. So again, there are also cerebral lesions of the thalamus can result. Again, we know that the thalamus is that filter for a lot of sensory information. So when you actually have a stroke in your thalamus or a tumor in your thalamus, that's going to impact what sensory information gets to the cerebral cortex. So when you have a lesion there, it results in decrease or loss of sensation from the opposite side of the body, that contralateral body. If there's a lesion in the somatosensory cortex itself in the brain, you can see contralateral decreased or absent conscious proprioception. You can also decreased or absent 2-point discrimination, stereognosia, localized touch from the opposite side of the body. The other two kind of disorders that we talk about that really involve sensory systems, sensory integration. So again, we know all this information comes into the brain and it's interpreted by the brain, so then it gives us useful information. But that ability of the brain to organize, interpret, and use sensory information comes with development, appropriate development. So we have patients out there who have difficulties integrating sensory information. Either those systems have not developed, or they're like disordered and they appear disorganized. So when you have an intact sensory system, integration occurs automatically once you've developed without conscious effort. Like we don't think about us interpreting temperature sensory information. Our body just does it. But not so with people who have difficulty integrating sensory information. So the brain must filter information or we'd be unable to function, just like with that opening slide, because there's so much sensory information coming in. Motor learning is linked to sensation. A lot of our early motor movements are because we see a toy and we want to get to it, or we see a bottle or a cup of water and we want to get to it, and that's how we start moving. And then as we are successful with moving, our sensory systems help us continue to move. We see a ball, we want to play with it. We see another child that we want to play with. All of those things, that all those senses really help us develop motor learning. And we have feedback systems, right? So you see a toy, you want to grab it, and you overreach. Then you've got this feedback system that says, oh, you missed the ball or you missed the toy, and then you try again. So hopefully those feedback systems also work. But with some of our patients, a lot of that sensory integration and those feedback loops don't work successfully. So those folks can get really frustrated, and then they choose not to move to avoid sensations. So as a motor task is practiced, we learn to anticipate and correct or modify our movements based on sensory input that's organized and integrated by the central nervous system. But if our central nervous system isn't developing properly, maybe we have a lack of myelination, maybe we have impairments in certain areas of the cerebral cortex, maybe we don't feel accurate information with our hands. So all of those things are going to impact your ability to kind of appropriately integrate sensory information. We also have a feed-forward control system, which kind of sends signals out in advance of movement that allows us to anticipate adjustments of movements and postural control. And again, we know that as even a typical nervous system, as that system ages, like in most of the other systems of the body, it becomes less effective. So what we see, particularly with the sensory system and aging, lipids and fats accumulate in the neurons, We see a decrease in the myelin production, which of course would impair the nerve's ability to conduct at those normal speeds. So we see decreased conduction velocity. We see a decreased number of dendrites. We see decreased numbers of sensory receptors themselves. And therefore, we have a decreased sense of vibration, loss of two-point discrimination, and decreased proprioception. So we want to keep the sensory system and the nervous system as healthy as we can, as long as we can. So that is the end of the sensory system lecture. Talk to you later. Bye.